Doc, anything to comment about the current menace of Muguka and Miraa in Mombasa County, a drug very close to you, Docket? Yes, Muguka and Miraa are one of the most commonly abused drugs that are associated with psychiatric complications such as psychosis. But I may not necessarily comment on Mombasa County situation, but just generally from the information that we currently have, or I currently have. So from research, there's a lot of information that we know about Miraa, which is Khat. And a lot of this research is from outside countries, so like Yemen or countries in the Horn of Africa. And what they're telling us is that the psychoactive substance or component in Khat is what we call cathinone. And the chemical structure of cathinone, which is what we find in Khat, is very similar to that of amphetamines. And the effects that are produced by chewing Khat are quite similar to the ones that are produced by taking amphetamines. And remember, amphetamines are the drugs that we prescribe for ADHD. I'm not saying that taking them together is the same, but from research, that's what we understand. And so the effects of chewing Miraa, a person gets very excited, there's increased alertness, the person gets very euphoric or a euphoria mood. But what we're seeing from different studies is that it's the excessive use that could contribute to the psychiatric complications, or it's the increased tolerance where a person, for example, used to use 10 sticks or maybe 50 grams of leaves to achieve that stimulation or excitement, but tolerance means that now they need 100 grams of the same leaves to get the same effect that they were getting at 50 grams of chewing the leaves. And so increased tolerance and dependence where a person now can't function until they chew Miraa, that may be associated with psychiatric complications. And the other question comes in, there are people who chew Khat and never develop psychiatric complications, but others do. And so there's a question that perhaps the complications of psychiatric manifestations are usually seen in a person who already carries a vulnerability for maybe schizophrenia or bipolar. And so they have either a family member or they're carrying a genetic marker that already predisposes them to these illnesses. And so chewing Khat is sort of like the switch that now produces the onset of that illness, and so now produces the symptoms of psychosis. But still, that is research that's still ongoing. Now, Muguka is the one that we still don't know much about. We still don't have a lot of research to tell us exactly what the content of Muguka is, if it's the same as Miraa. Some people say it is, or if it has different components. Again, with Miraa, with Khat, there's still other components in it. There's still other ingredients in Miraa that we haven't quite understood their function yet or their utility. So Muguka, from the local news information that we're getting, is that one, it's very cheap, or it's cheaper than Miraa, and so it's easily accessible to people than Miraa. And then anecdotally, meaning from experience, we are likely as clinicians, and this is because I have also talked to other clinicians, they would say that Muguka seems to be associated more with psychosis or psychiatric manifestations than Miraa. It seems to be more stimulating than Miraa, and even the people who use them would say this. And so Muguka seems to pose much more danger in terms of complications of psychiatric illnesses or symptoms than Miraa. And I'm not in any way saying that people should continue using Miraa and not Muguka, but we still need to do a lot of research. We still need to investigate these two substances, these two drugs, to understand what they are and what implications they have on the psyche, on the mental health of an individual.